Have you ever sat in a doctor's office and been told directly or indirectly that your pain doesn't match what they're seeing on the scan? Maybe you were told it's a small lesion, it shouldn't be causing that much pain, or your results don't look that bad. Worst of all, nothing was said, but the implication was clear that somehow the severity of what you're feeling isn't real, isn't justified, isn't explainable. I want to say something clearly right at the start of this video. Your pain is real. Your pain has a pattern, and your pain has a root. The disconnect you've been experiencing between what shows up on imaging and what you feel in your body isn't a mystery. It's actually one of the most well-documented and most consistently misunderstood aspects of endometriosis. And today, we're going to make sense of it, because here's what modern medicine often misses and what TCM has understood for centuries. The terrain determines the experience. Hey everyone, welcome back to the channel. If you're new here, I'm Megan, and I help women navigate their fertility journey using traditional Chinese medicine and holistic health practices. The biomedical disconnect. Let's start with what Western medicine tells us, because it's important to acknowledge what research actually shows. The staging system for endometriosis, stage 1 through stage 4, was designed to describe the extent and location of lesions. It was not designed to predict pain, and the data reflects this clearly. There's no reliable correlation between lesion stage and pain intensity. Some women with stage 4 endometriosis, the most extensive lesion involvement, report minimal pain. Some women with stage 1, minimal lesion burden, are debilitated by their cycles. The scans are not telling the whole story. They never were. This is not a failure of the woman. This is a limitation of the measurement tool that was never designed to capture the full picture. And when we only look at structure, at what is visible on imaging, we miss the functional, the energetic, the emotional dimensions of what is happening in the body. This is exactly where TCM steps in, not to replace diagnostics, but to complete the picture. The TCM lens, why terrain determines pain. In TCM, pain intensity is not determined by the size or number of lesions. Pain intensity reflects the degree of stagnation and the sensitivity of the terrain that stagnation is occurring within. Let me walk you through 5 TCM factors that explain why 2 women with the same diagnosis can have completely different pain experiences. Factor 1, degree of stagnation. When there's an obstruction, there's pain. The more complete the obstruction, the more blocked the flow of qi and blood, the more intense the pain signal. But the degree of stagnation is not determined by the lesion size. It's determined by the underlying patterns driving the stagnation. A woman with minimal lesions but severe liver constraint, cold in the uterus, and years of emotional suppression may experience far greater stagnation and therefore greater pain than a woman with more intensive structural involvement, but a more resilient constitution and better qi circulation. This is why the scan tells us what is present, TCM tells us why it hurts. Factor 2, cold presence. We talked about cold in the last video in the context of root causes. Here, I want to bring it into the pain conversation specifically. Cold causes contraction. When cold is present in the uterus, the tissues really tighten, blood flow slows, and the ability of the uterus to contract and release during menstruation is significantly impaired. This creates a cramping, gripping, pulling pain, often described as the uterus being in a vice. The key clinical indicator here is thermal response. Does heat relieve the pain? If a hot water bottle or heating pad makes a significant difference, cold is almost certainly involved. This matters enormously for treatment because warming the uterus is a specific therapeutic strategy, not just a comfort measure. Factor 3, liver constraint. The liver governs the smooth flow of qi. When liver qi is constrained, the entire system becomes tightly wound. Imagine a hose that is kinked. Pressure builds behind the kink, and anything trying to flow through meets resistance. Women with significant liver Qi constraint often experience pain that is worse with stress, that fluctuates with their emotional state, that intensifies before the period begins, and sometimes eases once flow is established. The pain often has a distending pressure quality rather than a fixed, heavy quality. They may also notice breast tenderness, irritability, sighing, and a sense of emotional tightness in the chest. The body holding what the mind is processing. Factor 4. Emotional repression. This is the conversation that I believe is the most needed and the most avoided in discussions about endometriosis. In TCM, unprocessed emotion doesn't just disappear. It lands in the body. Grief that isn't expressed accumulates in the lungs. Anger that cannot be spoken constricts the liver. Chronic worry depletes the spleen. Fear that is carried alone erodes kidney qi. When emotions are chronically suppressed, when a woman has learned to endure rather than express, to manage rather than to feel, to push through rather than pause, that holding pattern becomes a physical pattern. The same muscles, fascia, and organ systems that tighten with emotional suppression are the ones that surround and support the uterus. Endometriosis is often not just a gynecological disorder, it's a pattern of containment, overfunction, silent endurance. I want to be careful here because this is not about blame. This isn't about saying that endometriosis is caused by unresolved emotions. It's about recognizing that the body is a whole system and that everything we carry somewhere. For many of my patients, addressing the emotional layer is not secondary to the physical treatment. It is inseparable from it. Factor 5. Shen involvement. This is a layer that Western medicine has no framework for, and yet it is clinically real and clinically significant. In TCM, the Shen refers to our spirit, our consciousness, our mental, emotional vitality. It's housed in the heart, and when Shen is disturbed by chronic pain, by grief, by the exhaustion of fighting a condition that others minimize, by the emotional weight of fertility challenges, pain sensitivity increases dramatically. Think of it this way. When you're rested, supported, and emotionally resourced, the pain is more tolerable. When you're depleted, isolated, and carrying fear, the same physical sensation registers as significantly more intense. This isn't weakness. This is neuroscience. And in TCM, we call it Shen disturbance. For many of my endometriosis patients, especially those navigating fertility challenges, the Shen layer is highly involved. The anxiety of wondering whether the body will support pregnancy, the grief of cycles that feel like loss, the anger of not being believed, these are not peripheral concerns, they are clinical factors. Addressing the Shen through the heart and kidney axis, through specific acupuncture points, through holding quality of therapeutic relationship, can shift pain experience in ways that no herb or needle alone can achieve. The validation bridge. If you sat in a medical office and had your pain minimized, if you've been handed results and been told that they don't explain what you're feeling, if you've started to wonder whether you're exaggerating, whether it's really as bad as it seems, whether something is wrong with you rather than with the assessment tools being used, you're not exaggerating. You're not oversensitive. You're not making this up. The mismatch between your scan and your symptom experience is real, and it has an explanation. It's just an explanation that requires a different lens to see it. TCM offers that lens, and I work collaboratively with medical teams regularly. But because TCM asks a fundamentally different question, not just what is present in the body, but what is the terrain, what is the pattern, what is the body trying to communicate? Pain is not random. And when we stop treating pain as a problem to be suppressed and start treating it as a communication to be understood, everything shifts. The treatment strategy shifts, the relationship with your body shifts, and for many of my patients, the fertility outcomes shift too. The fertility connection. For those of you who are here because you're preparing to conceive, want to make the connection between pain intensity, terrain, and fertility very explicit, when pain is high, it tells us stagnation is high. Stagnation, obstructed qi and blood flow, is directly antagonistic to the conditions needed for conception. Implantation requires a warm, nourished, receptive lining. It requires adequate blood supply. It requires smooth flow of qi to support the embryo's journey and attachment. When cold is present, the uterus cannot provide warmth that supports implantation. When liver qi is severely constrained, the smooth flow required for conception is interrupted. When Shen is disturbed, the body is in a state of physiological stress that is not conducive to deep receptivity that conception requires. This is why reducing pain done properly through addressing the terrain rather than simply suppressing the symptoms is not a separate goal from supporting fertility. They are the same goal. A body with less obstruction, more warmth, better qi flow, and a calmer Shen is a body better prepared for conception. And this is the precision that TCM brings. Not vague balance, not general wellness, a specific understanding of your pattern, your terrain, and the targeted interventions that shift it. Here's what I want you to walk away knowing today. Your pain intensity is not a measure of how dramatic you are. It's a measure of the degree of stagnation in your terrain, and terrain can be changed. A scan that looks mild doesn't mean your suffering is mild. A diagnosis of stage 1 doesn't mean your pain is stage 1. The map is not the territory. The imaging is not the experience. And any practitioner or any system of medicine that treats those things as equivalent is missing the most important information. Your body is not punishing you. It's communicating. And when we learn to listen with precision, with compassion, and with the right clinical framework, we can respond in a way that actually changes things. And the terrain can be shifted. If you're navigating endometriosis and preparing to conceive, and you're ready to stop managing your symptoms and start addressing your actual terrain, I want to invite you to come in for an initial appointment with me at the Acupuncture Oasis in Toronto or with a TCM practitioner near you. This is how we can identify your specific TCM pattern, map it to your cycle data, and build a personalized strategy that works with your body's communication rather than against it. The link is below. And if you're new here, welcome. Subscribe so you don't miss the rest of the series. We're going deep on dysmenorrhea, cysts, fibroids, and polyps over the next few weeks, all through the TCM lens, all for women who are preparing for conception or just want to regulate your cycles. You can explore more at the link below. Free resources, more videos, everything you need to start understanding your cycle as the vital sign it truly is. If this video helped you feel seen, please share it. There's someone in your life who has been told their pain doesn't match their scan, who needs to hear that there is a framework that can take their experience seriously. Send it to them. It might be exactly what they need. I'll see you in the next video. Until then, be curious, be informed, and be vibrant.